So if you go to an orthopedic surgeon for like a total knee replacement, you go in with a very specific expectation, right?
Right, yeah, you want it fixed.
Exactly. You assume that new titanium joint is going to let you, run or hike or play tennis again, but you definitely do not expect the very act of running to actively dissolve the titanium.
No, I mean, that would be a pretty fundamental flaw in the design. You inherently expect a medical fix to withstand the exact physiological function it was designed to restore. It's supposed to be durable.
Right, a permanent mechanical solution.
Right.
But, and this is what we're getting into today on the deep dive, what if we stepped into a medical scenario where the treatment successfully restores a physical action, but that very action becomes the exact mechanism that destroys the treatment?
It's basically the ultimate physiological paradox.
It really is.
Yeah.
So for you listening, we have a highly specific, honestly just mind-blowing mission today. We are going to explore how the mechanical shear stress of coitus-sexual intercourse alters the degradation kinetics of cross-linked hyaluronic acid when it's placed in the anterior lamina propria of the vagina.
It's such a wild concept. The cure enables the activity, but the activity is, well, mechanochemically guaranteed to degrade the cure.
Exactly. And to figure out how this actually happens, we've curated a wildly eclectic stack of sources for you. We're pulling from a clinical case report by Mazzarella and colleagues on treating vulvovaginal atrophy.
Fascinating caper.
It really is. And we're crossing that with Dr. Jennifer Berman's clinical tips for achieving orgasm through intercourse. And then we're basically smashing all of that together with heavy finite element analysis of the pelvic floor and like deep rheological studies on the molecular breakdown of hydrogels.
It's a brilliant intersection, really. You've got clinical medicine, biomechanical engineering, and molecular chemistry all colliding. But to really grasp how intercourse breaks down this treatment, I think we first need to look at the clinical canvas.
Yeah, set the stage for us.
Right, so we need to understand the tissue environment. Like, why is this hyaluronic acid, or HA, being injected into the anterior lamina propria in the first place?
Okay, so what is the actual condition we are trying to treat here?
The condition is vulvovaginal atrophy. You'll often see it abbreviated as VVA, and it's a hallmark of the genitourinary syndrome of menopause. Essentially, as a woman ages, particularly moving into menopause, there is this significant drop in hormone levels, specifically estrogen and androgens.
And estrogen is pretty vital there, right?
Crucial. It maintains the structural integrity of the vulvovaginal tissues.
So when that estrogen drops, the tissue just fundamentally changes.
Drastically. I mean, the structural support within the lamina propria, which is a layer that's usually rich in fibroblasts, collagen, and elastic fibers, it just begins to break down. The tissues lose all their elasticity.
Wow, okay.
Yeah, and you also see a loss of adipose tissue, so fat, in the labia majora. The end result is a severe loss of hydration and, really importantly, mechanical protection.
And for the patient, this doesn't just mean dryness, does it? Because I was looking at the Mazzarella study, and they mentioned things like petechiae and pallor. And if I'm remembering my medical terminology right, petechiae are like tiny blood spots.
Spot on, yeah.
So meaning the tissue is actually micro-tearing under friction.
That is exactly correct. The tissue becomes so fragile and so poorly vascularized, which is the pallor or paleness you mentioned, that any mechanical friction just causes microscopic trauma.
That sounds awful.
It is. So for the patient, intimacy becomes deeply painful instead of pleasurable. It leads to heightened sensitivity, recurrent tearing, and just significant sexual dysfunction across the board.
And historically, the go-to treatment has been hormonal therapy, right?
Yeah.
Just giving back the estrogen. But the sources note that this isn't an option for everyone.
Right, exactly.
Like patients with a history of oncological diseases, breast cancer, for example, they often cannot take exogenous hormones because it could trigger a recurrence.
Which is exactly where the Mazzarella case report introduces this really fascinating non-hormonal treatment. They detail a multi-layer hyaluronic acid approach.
And HA is naturally occurring, right?
It is. It's a naturally occurring polymer in the human body that basically acts like a sponge. It retains massive amounts of water. You usually hear about it in dermal fillers, to plump lips or smooth out wrinkles.
Right.
But here, it is being used functionally to completely rebuild the vaginal tissue architecture.
And the protocol they used on this one specific 48-year-old patient, it's incredibly precise. They didn't just inject a generic gel everywhere and hope for the best.
Not at all.
They used a layered technique. So they injected a cross-linked HA into the deep dermis to restore volume. But then they injected a non-cross-linked HA which was enriched with calcium hydroxyapatite, directly into the anterior vaginal wall. Specifically, and this is wild, about 1.5 centimeters from the urethral meatus, right in the lamina propria.
Right, and colloquially, a lot of people listening probably know that specific anatomical region as the G-spot area.
Oh, interesting.
Yeah, it's highly innervated and structurally just critical for sexual response.
But wait, if the goal is to have this gel kind of mimic natural tissue and just act as a hydrating cushion, why use a synthetic chemical to cross-link it in the first place? Why not just use pure natural HA?
Well, if you inject pure natural HA into the body, your enzymes will clear it out in a matter of days. It just vanishes.
Really, just days.
Just days. So to make it actually last as a structural support, you have to cross-link it. You're essentially tying the HA polymer chains together into this complex 3D web. Now, usually HA fillers use a chemical called BDBE to do this. But in this specific VVA protocol, they used PED-DE, that's polyethylene glycol diglycosidyl ether.
That sounds incredibly harsh for such sensitive tissue.
It actually serves the exact opposite function. The researchers specifically chose PED-DE because it has a significantly lower inflammatory profile than your standard crosslinkers.
Oh, I see.
Yeah, it effectively cloaks the gel, reducing the immune recognition, so the body is way less likely to attack it as a foreign substance. Plus, its biomechanical properties allow it to mimic the viscoelasticity of natural tissue just beautifully.
And the results for this patient were nothing short of staggering. They measured her progress using the FSFI6, so the Female Sexual Function Index. And it scores desire, arousal, lubrication, orgasm, satisfaction, and pain. At baseline before the treatment, her score was a 6.0.
And just to put that in perspective for you listening, a score of 19 or below indicates female sexual dysfunction. So a 6.0 is
Very bad.
highly dysfunctional. It means severe clinical pain and an almost total inability to engage in normal sexual activity.
But then, just 6 weeks after this multi-layer HA treatment, her score skyrocketed to a 24.0.
It's incredible. She went from severe clinical dysfunction to a highly functional, entirely pain-free state. The petechiae, the pallor, the structural dryness, it all completely resolved.
If you are listening to this and trying to picture the mechanics, we have basically injected a highly engineered molecular shock absorber and hydration sponge right into the vaginal wall.
Exactly.
And it completely works. But if the entire goal of this procedure is to allow the patient to resume active dynamic intimacy, we really need to know what actually happens to that molecular shock absorber when it gets taken off-roading.
Right, because intercourse is a profound mechanical event. To understand the fate of that HA gel, we have to map out the specific forces acting on it during coitus.
And I found it brilliant how the sources tackled this. We look at Dr. Jennifer Berman's clinical advice on sexual health. When you read her tips for achieving orgasm, you realize she isn't just giving intimacy advice. She's essentially writing an engineering manual on how to maximize biomechanical friction and pressure.
That's a great way to look at it. Analyzing her recommendations purely through the lens of physics and engineering reveals a very clear objective.
Like what?
While she advises techniques like strengthening the grip, which involves actively flexing the pelvic floor muscles to contract the vaginal walls around the penis, she also recommends deep thrusting and adjusting the pelvic tilt.
Like putting pillows under the back.
Exactly, placing pillows under the buttocks to change the angle of entry.
So all of these actions basically share a singular physical goal, which is maximizing the lateral pressure and friction directly against the anterior vaginal wall, which is exactly where our HA shock absorber was injected.
Right on top of it.
Our sources even cite a patent for a condom designed with, circumferential microtubules?
Yeah, the whole point of that patent is to cause a physical, textured bulging on the shaft to further increase that exact lateral pressure and frictional drag against the vaginal tissues.
So we have placed this incredibly delicate gel exactly where the maximum friction happens. But I mean, how much force are we actually talking about here? Is it enough to threaten the structural integrity of the treatment?
Yeah, let's put hard numbers on those forces using the finite element analysis, or FEA, study of the pelvic floor. When a woman undergoes high intra-abdominal pressure...
Wait, you mentioned the Valsalva maneuver earlier in the notes. What is that in this context?
Oh, right. The Valsalva maneuver is basically when you attempt to forcefully exhale while keeping your airway closed, like when you're bearing down during heavy lifting, or in this context, core-engaging sexual activity.
Got it.
So this creates massive pressure inside the abdomen, and the FEA data reveals that this pressure is not distributed equally across the pelvis. The anterior vaginal wall and the top of the vagina bear incredibly high shear strain. We are talking about strain levels reaching 0.5.
Okay, I don't speak engineer, What does a shear strain of zero point 0.5 actually mean for the tissue?
It means the tissue is being deformed by 50% relative to its original state.
Wow.
Yeah, that is a massive amount of mechanical distortion.
And we have to remember the canvas we are working with here. We are not talking about the pelvic floor of a 20-year-old.
That is a crucial variable. Hex vivo tensile tests on pelvic floor supportive tissues show that a young, healthy vagina is incredibly elastic. It can handle uniaxial strain up to 20% before it even risks rupture.
It just yields and
It
stretches.
yields gracefully. But the data also shows that with age, and especially after that hormonal drop of menopause we talked about, the elastic modulus changes, these tissues become much stiffer.
So think about that for a second. You have an aging, stiffer tissue environment. It doesn't stretch or absorb impact the way it used to. And suddenly it is experiencing intense, repetitive shear strain, friction, and localized compression from intercourse.
Yeah.
What on earth does that intense, high-pressure mechanical environment do to a pocket of synthetic HA gel just sitting right in the middle of it?
Well, to answer that, we have to dive into the physics of the gel itself. We need to look at its rheology.
Rheology, the study of how things flow and deform under stress. I always struggle to visualize this with hydrogels, honestly.
It can be tricky.
Yeah.
Basically, hyaluronic acid hydrogels are viscoelastic. This concept is totally foundational to understanding the paradox.
Viscoelastic meaning.
Meaning they aren't purely solid and they aren't purely liquid. They are both simultaneously. So they have a storage modulus referred to as G prime, which acts like a solid elastic spring. It stores kinetic energy and allows the gel to bounce back to its original shape.
But they also have a fluid component, right?
Yes, exactly. They have a loss modulus, G double prime, which acts like a viscous fluid. This dissipates energy and allows the gel to physically flow and spread out.
Okay, so under normal resting conditions in the body, I assume the gel just sits there, mostly acting like a soft, bouncy solid. The G prime is dominant. But during intercourse, it is subjected to massive shear stress. And the sources talk about something called shear thinning. What does that actually look like?
So shear thinning is a non-Newtonian behavior where the viscosity of a fluid decreases as the shear rate increases. During coitus, you have rapid, cyclic, back-and-forth thrusting.
Okay.
This generates a very high shear rate. As that rate climbs, the viscosity of the HA gel absolutely plummets. A great way to visualize this is, well, think of a glass bottle of ketchup.
Ah, the classic physics analogy.
It works perfectly. You turn the ketchup bottle upside down, and it just sits there, right? It acts like a solid block. But the moment you smack the back of the bottle, when you apply that sudden, forceful shear stress, the ketchup instantly shear thins. It flows like water.
And the HA gel in the vaginal wall is doing the exact same thing under the intense friction of intercourse.
The exact same thing.
The numbers from the dermal filler studies in our sources honestly blew my mind. They looked at a highly cross-linked HA filler called Teosyl Ultimate. And I want you to read the viscosity drop on this because I wouldn't believe it if I didn't see the data myself.
Yeah, the numbers are wild. So at a very low shear rate, when the gel is basically at rest, it has a massive viscosity of 1,663.92 Pascal seconds.
So it's thick.
Very thick, stiff, and holds its shape perfectly. But under high shear stress, that viscosity drops all the way down to just 0.31 Pascal seconds.
From over 1,600 down to 0.3. I mean, it practically liquefies under the mechanical stress.
It fundamentally changes states. But we have to remember, intercourse is not just a single smack of a ketchup bottle. Coitus represents cyclic loading.
Meaning it's continuous.
Right. It is a repetitive, continuous mechanical stress over an extended period, and this introduces a phenomenon called hysteresis.
Okay, let's unpack hysteresis because this seems to be where the actual damage happens to the gel.
Yeah. When you apply a heavy load to a viscoelastic material and then remove it, the material doesn't follow the exact same path back to its original state. Energy is lost or dissipated, usually as heat or internal structural changes.
Gotcha.
That difference in the energy pathway is hysteresis. In the context of our HA hydrogel, the immense kinetic energy from the friction and deep thrusting is absorbed by the gel network.
But the laws of thermodynamics dictate that energy has to go somewhere.
Right, precisely. It goes directly into the chemical and physical bonds of the gel matrix. The repetitive cyclic loading causes the physical entanglements and even some of the dynamic covalent bonds within the cross-linked HA network to forcefully rupture. Yeah, in rheological terms, this leads to shear fragmentation. The large cohesive mass of the hydrogel begins to physically fracture into smaller and smaller microdomains.
Okay, so if we pull back and look at the bigger picture here, the mechanical friction of sex is literally liquefying the gel through shear thinning and simultaneously fracturing the gel network into microscopic pieces through cyclic loading. The intercourse is physically smashing the shock absorber.
That's a great summary.
But how does that physical smashing relate to the biological breakdown of the treatment? Like, why does the body absorb the fractured gel faster than the intact gel?
And this is where we introduce the mechanochemical catalyst. We have to talk about the biological eraser of the human body, which is hyaluronidase.
That's the natural enzyme that hunts down HA, right?
Specifically, endo-beta and acetyl hexasaminidase. This is an endogenous enzyme that is constantly present in your tissues. Its primary function is to hunt down hyaluronic acid, latch onto it, and cleave the beta-1-fel-4 glycosidic bonds.
Which does what exactly?
It chops those long, beautiful HA polymer chains into tiny, bite-sized oligosaccharides that the body's lymphatic system easily clears away and metabolizes.
Okay, but in our VVA patient, the Mazzarella study used PEG-stay to cross-link the HA. And the whole point of that chemical cross-linking is to act as molecular armor, isn't it?
Exactly. It bundles the HA chains so tightly together that the hyaluronidase enzyme cannot physically reach those beta-1-4 glycosidic bonds to cut them. The armor keeps the enzyme out, which is exactly why cross-linked fillers last for months or even years instead of days.
So under normal resting conditions, that cross-linking shield holds up beautifully.
It does.
Yep.
But here is the massive aha moment of the entire deep dive. The mechanical shear stress of coitus fundamentally alters the enzymatic degradation kinetics.
Because of the fragmentation.
Yes, remember that cyclic shear strain? The physical trauma of intercourse fractures the large gel mass into thousands of smaller microdomains. By breaking the gel apart, it massively increases the accessible surface area of the hyaluronic acid.
Okay, so if you are listening and want a visual for this, it's basically like taking a giant block of ice and tossing it to a wood chipper.
Oh, that's a perfect analogy.
Right. Because a solid block of ice takes hours to melt on the sidewalk because the ambient heat can only hit the outside layer. The center is totally protected.
Right.
But if you run that ice through a wood chipper, crush it into a fine powder, and spread it out, it melts in seconds. Because the surface area exposed to the heat is exponentially larger.
That is exactly what happens. The comparative filler studies in our sources demonstrate this phenomenon perfectly. They found that gels, which were highly prone to shear fragmentation under stress, degraded enzymatically much, much faster than their degree of chemical modification would suggest.
Wow.
A clinician might look at the PEG-D chemistry and think, oh, this heavily cross-linked gel should last a year. But once it undergoes repetitive shear stress, it degrades rapidly.
So the mechanical stress doesn't just squish the gel, it shreds the armor.
Yes.
The physical shear stress of sex acts as a catalyst. It breaks the gel down into tiny pieces, dramatically increasing the surface area, which basically opens the floodgates for the body's natural hyaluronidase enzymes to rush in and eat the gel from every conceivable angle.
It is a profound synergy between physics and biology. We actually see a similar principle in joint health.
Oh, really?
Yeah. When the natural hyaluronic acid in your synovial fluid degrades, it fundamentally alters the chondrocyte's sensitivity to shear strain. The mechanical environment and the biochemical degradation are intimately linked feedback loops.
That makes total sense.
So in the vaginal wall, inducing intense shear strain physically creates the optimal conditions to accelerate the enzymatic degradation of the HA. The mechanical kinetics fundamentally drive the biological kinetics.
This is just incredibly fascinating. Let's summarize the journey we've just taken because it's a lot. We started with a real-world clinical problem, vulvovaginal atrophy, and a brilliant solution, injecting cross-linked HA into the anterior lamina propria to restore hydration, volume, and cushioning.
Right.
Then we mapped the intense biomechanics of intimacy, revealing how deep penetration, pelvic tilt, and pelvic floor contractions create massive shear strains on those specific, aging, stiffening vaginal walls.
Which is an intense environment.
Truly. And then we looked at the rheology of the gel, watching it shear thin like ketchup and physically fracture into microdomains under the cyclic loading of intercourse. And finally, we saw how that physical fragmentation drastically increases the surface area of the gel, essentially serving it up on a silver platter for the body's natural hyaluronidase enzymes to rapidly break it down.
It is a highly complex, beautifully interconnected cascade of events.
But there is a tragic irony here for you to consider as a listener. The entire purpose of this HA hydrogel treatment is to restore the patient's ability to have pain-free, deeply enjoyable intimacy. And it works beautifully.
It really does.
But the very mechanical act that the treatment successfully facilitates is the exact mechanism that speeds up its own demise. The cure allows the coitus, and the coitus destroys the cure.
The irony is unavoidable with current materials. But if we connect this to the broader horizon of biomaterial engineering, this raises a genuinely exciting question for the future.
Oh, what kind of question?
Well, we now know definitively that mechanical shear accelerates enzymatic degradation because it physically ruptures the polymer network. But what if we could reverse that logic?
What do you mean?
Could future engineers design smart HA hydrogels for the lamina propria, utilizing dynamic covalent bonds that don't fracture under shear stress, but actually stiffen or self-heal?
Oh, wow. So using the friction as fuel, basically.
Imagine a treatment matrix where the intense friction and cyclic loading of coitus doesn't act as a destructive force, but rather as a regenerative mechanical trigger.
That is wild.
A gel that senses the shear strain and uses that kinetic energy to recross-link and strengthen the tissue matrix, making the treatment more robust the more it is used.
Now that is a paradigm shift. A treatment that gets stronger under pressure instead of, melting away into a wood chipper. Thank you for joining us on this deep dive today. We hope this look into the hidden mechanics of intimacy, hydrogels, and enzymes has completely changed how you view the medical treatments happening beneath the surface. Keep questioning the hidden physics of the world around you. And remember, sometimes the very thing that fixes the machine is exactly what the machine was built to break.